say this client comes in and they're pretty banged up. They got into a car accident. What should they look for, and what are some red flags that they should look for, in your opinion, in reference to injuries?
Sure, and that's a great question. We do see quite a few injury, cases in all of our clinics. I wouldn't say it's 100% of our patient base, but I would say probably close to 40 to 60% of our patient base. So I think, I'm in a unique position to have a good understanding of what injuries are like and what, attorneys should look for when evaluating a case. First of all, the first and foremost thing is, having a client who's ready and willing to get in for an evaluation. Because, certainly if the client is not going to get the care they need, I can imagine on the lawyer side, the lawyer perspective, that's going to be difficult for them to manage a case like that and obtain the highest possible result for the client. So that's first thing. I think somebody who's truly injured is going to want to get in and get treatment and be evaluated. So I think that's first and foremost, is just willingness and compliance. It's probably a better word, of their client. Number two, obviously, a lot of the injuries that we deal with in our practice we're not seeing a lot of fractures and things like that, but we do see a lot of soft tissue injuries, sprains, strains, disc herniations and bulges, sometimes traumatic brain injuries. So I think it's important, obviously that there's imaging ordered relatively early in the case. My perspective is, I don't like to wait more than a week or two before obtaining some type of imaging studies, because that's going to help me assess, really the degree of injury that the client or patient has and treat them accordingly. So obviously that's going to show you, hard facts right away, what's going on with this client. So I think that's another big factor to look at is, what are the results of the imaging studies. Now, that's not the be all and end all, because I can tell you, especially in the traumatic brain injury world, we get cases where you refer for an MRI and the MRI is maybe inconclusive or it doesn't necessarily show anything, but yet the client, continues to experience maybe, post-concussion syndrome or some type of response, that indicates that there's more than meets the eye than what's shown on the MRI. But in most cases, I would say the imaging studies are going to line up. So that's a very, very big component of it.